So, this is where health and aging intersects with innovation, and that's what we call today CONVERGE Louisville. Forbes magazine is called Louisville, nation's capital for aging care, because Louisville has the highest concentration of aging care headquarters and facilities than any other place in America. And that's a strength that we have leveraged as an attraction campaign with folks through GLI and the city. And I'm proud to say that HEN is the one that commissioned that study that brought that to light. It's given rise to entities like the Thrive Center, the Traeger Institute, the Louisville Healthcare CEO Council, and we've seen a recent emergence with healthcare startups in the area. So, and several of those companies are on display outside. So in addition to the great presenters, we also have a podcast with Resonate recordings out there, so be sure to stop by and share your stories with them. And we're proud to say that we've actually launched our own podcast, Health Economy. Our first presenter this morning was also our first episode. So episode 1, if you will, is available on Google Podcast, Apple Podcast, some other places, wherever you listen to your podcast. So, and there's a charging station, thanks to the folks at Vimark, that's located out here. So be sure to stop there and keep your phones charged as you tweet and share and do all that hip social media stuff that I know absolutely nothing about. But thank goodness I have a team of folks who do. Right now I'd like to bring up to the stage Ben Moore. He's the Senior Economic Development Director for Lifelong Wellness and Aging with Louisville Forward. So ladies and gentlemen, please welcome Ben Moore.
Good morning, everybody. How are we today? We're going to have to do better than that. Good morning, everybody. How are we today? All right, we'll work on it. It's certainly my pleasure to be here today for such an important and exciting gathering. And I want to thank David and his team at the Health Enterprises Network for putting this day together. Let's give it up for David and his team. My name is Ben Moore, and I'm the Senior Manager for Economic Development in the Lifelong Wellness and Aging Care space, which is a really long title for I work with companies in this area, health and aging innovation, to eliminate hurdles to their growth. We are a part of the Mayor's Office, and along with the economic development side of aging innovation, we work with groups across Metro for seniors in our community to find ways to age optimally at home or however they choose. Louisville Metro is an active partner in how folks age in our community. The topics and conversations and collisions that will happen here today are incredibly important to continuing the momentum, the economic momentum in our city. The community is big enough to do amazing things, but still small enough for meetings like this to push forward these exciting initiatives and help things happen a bit faster. We all need to embrace this culture of urgency. It's our time now to build on this economic growth and the success. And the aging innovation sector is so special to Louisville that it presents a unique opportunity, along with our growing aging population, to drive growth in this city. As the home to the largest collection of aging and home health headquarters in the nation, we have a great chance to break out at this moment. The Louisville Healthcare CEO Council, led by the incredible Tammy York Day, is bringing collective action to our community from the largest companies in this sector. And the work of the council will have far-reaching impact across our community and our country. We're excited for Tammy's leadership and the dedication of the council to companies growing and improving the economic vibrancy of the city in the aging innovation sector here in Louisville. The Louisville Entrepreneurship Acceleration Partnership, or LEAP, is another exciting new entity that's leveraging entrepreneurial ecosystem to accelerate growth and opportunity for startups and founders in our community. And we look forward to great things to come from this group. If you've not heard about them, please learn more, please engage. You combine these two groups with the incredible networking and connecting prowess of the Health Enterprises Network, with the research and innovation arm of University of Louisville's Traeger Institute, and the international reputation for technology that the Thrive Center brings to our community, and you can see why Louisville is so uniquely positioned in this space. And it's time for all of us to get excited, to get active, and understand how we can help move this forward. Our narrative is our own, And the time to break out is now. As we see so many folks aging, we have the opportunity to help them age well. And with all the technology you see, with all the caregiving techniques you see, and all the activity that you are experiencing in this community, this is the place, this is the conversation today that's going to help move that forward. So we're so excited that you all are here today. We hope that you connect. We hope that you learn something new or experience something new or hear about an organization maybe that you didn't know about, and that you take something from today and understand that this is what's going to move this community forward. Aging innovation is our value proposition to the world. So thank you all for being here today. We look forward to an amazing set of speakers and panels, and it is my pleasure now to introduce the Health Enterprises Network Board Chair, David Henley.
Let me also say good morning. And on behalf of the Board of Health Enterprises Network, welcome you to CONVERGE Louisville. I just hope that you're as excited about it as I am, because I missed it last year, and this year I said I've got to be here for this great event. I know that the program is going to be one of those that is a great example for how HEN brings local leaders and healthcare entrepreneurs together to help us bring visibility to aging innovation and other trends in the healthcare market. Well, let me just begin by saying a few thank yous. First of all, I want to say thank you to each one of you for being here today. It shows your commitment to growing the healthcare economy in Louisville. For that, I say thank you. I also want to thank all of our sponsors today, because had it not been for them, this event would not happen. AARP Kentucky, Humana, Round Tower, Vimark, University of Louisville College of Business, Resonate Recordings, Hall Render Killian Heath and Lyman, Hosperis Health, Edge Analytics, Alzheimer's Association, ADK Group, Click IT, PwC, Goodson Clothing and Supply Company, Behavior, Brio Care, My Family Channel, and Slingshot. Let's give them a round of applause. Health Enterprise Network is the region's premier healthcare network. As part of Greater Louisville, Inc., our mission is to champion and foster the growth of the Greater Louisville region's healthcare economy. Comprised of 1,100 plus healthcare professionals from 170 organizations, HEN is the convener, that breaks down barriers, opens doors, and is the catalyst for engagement with healthcare professionals and leaders. Simply put, we connect, solve, and grow. Connect. HEN provides connections that turn relationships into outcomes for the benefit of the entire community. Louisville's future depends on healthcare, and healthcare depends on connections. Connections are collaborations. HEN makes that collaboration happen by connecting you to the right people. Solve. HEN solves the challenges facing healthcare by bringing together the key players around an issue to facilitate outcome-based solutions. Grow. We grow healthcare businesses and the healthcare economy by making introductions, building partnerships, and promoting actions. We also grow individuals through our Healthcare Fellows program. Fellows are challenged to grow in their leadership capacity, increase their health-related knowledge, and expand their professional reach. HEN is definitely on the move. Here are a few of HEN's accomplishments. HEN's extensive and detailed map of the healthcare ecosystem and first ever documented history of healthcare in Greater Louisville continues to be a resource for healthcare leaders and local media. The entrepreneurial HEN VIP program, that's very innovative pioneer, more than doubled its size from 2017 to 2019, went from 23 to 60 companies. The HEN VIP program provides an unparalleled opportunity for entrepreneurs to connect and engage with the healthcare leaders, decision makers, and the community resources they need to develop their business. Several of those companies you saw out in the lobby. 5 HEN VIP companies have partnered with major corporations in the region to launch pilot programs that direct result from HEN introductions. 7 HEN VIP companies have participated in national pitch competitions because of a HEN referral. Our Healthcare Fellows program continues to expand the leadership capacity of up-and-coming healthcare executives. We now have over 300 fellows who are alumni of the program, and we are currently accepting applications for the 2020 class. Finally, and certainly not least, I wanted to make sure that we congratulate GLI for being named the 2019 Chamber of the Year. As part of GLI, Health Enterprises Network played an important role in that recognition, so there is reason for all of us to celebrate. Let's give a round of applause for GLI. Quite a milestone. Thank you again for being here. I think it's going to be a great program today. And next, I would like to bring up HEN board member Tom McMahon, Market Vice President at Humana for Kentucky, Indiana, and Ohio. Tom will introduce today's first presenter.
Standing between you, oh, hey, good morning, everybody. I stand in between you and the speaker, which is better than standing in between you and the cocktail party, but I'll still make it fast. So I'm Tom McMahon. I work for Humana. Thank you to all of you for coming out this morning. I know traffic apparently is pretty rough, so I think we'll see a few more folks trickle in. I really appreciate David Bushman taking a moment to recognize Mr. Jones. I have only worked at Humana for less than a year and a half, but I've worked in healthcare in Louisville for 30 years and met him 20 years ago. And just a really, you could say so many things, but a really unique blend of incredible intellect, but also authentically curious and interested in people. So you just can't teach that. So really, really special. So thank you, David, for that. Appreciate it. So I'm excited to introduce William, but I'll start with a question. So who has listened to the Health Economy podcast that people have been talking about this morning? So it's really easy to listen to. I listened to it again this morning because I liked it that much. I don't listen to podcasts, but now I do. And I told William I was able to actually listen to it on an airplane's Wi-Fi, if you can believe that. So nothing's easier than that. I guess if you can listen to it that way, you can get it anyway. So I encourage you to check it out. Very interesting. I learned a couple things about William I did not know. I did not know that William had worked elsewhere before Humana. I had the idea that after pharmacy school at UK, he had come to a Humana hospital, and you know, here we are later. But he had a couple interesting roles. One of was a role that was with another company that served the Medicaid program, so that was pretty fascinating. There's a lot to learn in Medicaid, I can tell you the same. So, but in any case, William is a graduate of Transylvania and also has a doctor of pharmacy from University of Kentucky. He leads our healthcare services and pharmacy segment, which, as we think about the complexity of healthcare, they deal with some of the hardest problems we solve. And how do you reach people, and what should you do when you reach them, and how do we risk stratify, and it just goes on and on and on. So I appreciate what his team does. They're a very important business partner to my team. So with that, I'll ask William to come to the stage and introduce him. So please join me in welcoming him.
Thanks, excuse me, thanks, Tom, and thanks for having me. When I was asked to deliver this presentation, I jumped at it because the notion of converge and the notion of convergence of health and aging is right in the sweet spot of where, candidly, I spend a lot of my days and my time throughout my work at Humana and what we do to try to help be part of solving the aging solution that's going on in America as we see what's happening there. I'm a lifelong Kentuckian. I did go to school a few miles to the east, and the work that we're doing at Humana and our 45,000 associates does every day have us waking up thinking about the aging of America. And what I'd like to share with you today is our perspective, and a perspective around the change and the amazing change that's going on here in the U.S. marketplace. And so I want to talk with you about the landscape, give you a perspective on what's happening there, give you a perspective around today's senior and what we see going on and how they're thinking about their health, but also the aging process and what retirement and those sorts of things mean. And I want to give you a perspective around the impactful areas and areas that we think we can help solve as we go through this aging process and as the convergence happens throughout each of our lives as we all go through that process. And so let's dive in. When you think about the big trends, there's a number of big trends impacting the marketplace. And these big trends are fueling a lot of amazing things happening in the U.S. They're fueling mega mergers and acquisitions. And you look at things like CVS and Aetna and Cigna and Express Scripts, and I could keep going on and on. They are fueling a number of things that are happening in the market there. They're fueling policy. They're also fueling consumer demand. Consumer demand cannot be higher than it is today. And so it's the rise of consumer expectation is one of the things that we're thinking about as we show up every day, because consumers want more. This question of what does retirement mean is a very interesting question. The question of, I was in the workforce yesterday and I have a lot of means today and I'm healthy and I'm 65 years old versus I'm 80, I've depleted my resources, I'm not coming out of the workforce, my health needs have changed. Understanding the context of how someone's going through that part of their life is really important. And so it's that consumer expectation that really matters. It's the capacity creation. We've seen Uber create capacity in the market for cars and for riding in taxis. I'm not sure I knew I needed Uber, but today I couldn't live without it. In fact, I took it here to this morning. And when you think about the world that we live in with the aging of America, the nursing shortage that will hit us in 2023, the behavioral health shortage that is already in front of us, we have capacity constraints that we've got to be thinking about. How do we solve those? How do we help solve those conversations? Because it's so important to helping our customers deal with health and the aging process. Digital. Digital couldn't be higher today. The rise of digital, the rise of the expectation. I don't fear Amazon coming into the healthcare marketplace, but what I do believe Amazon is teaching us is that customers want more. They're raising the bar on what they expect from every company that's dealing with healthcare in America. And understanding that conversation, understanding how that's showing up, matters. The government matters. As we see what's happening in this crazy healthcare economy with Obamacare and the individual mandate and Medicare and Medicaid and the group commercial business and all those things that happen within that, there is more and more of a notion of the government being more involved in healthcare in America beyond just simply the financing and funding around it. And it's something that we've got to understand the impact of that. I mentioned the mega mergers. Those are really important. Those are also changing the landscape. This idea of value-based care is really important. When you think about physicians moving from volume-based practice, where the more I do, the more I get paid, to value-based, where they care about the whole person and they deal with that person end to end, is a very important conversation to help consumers improve the quality of their life and do the one thing that they want most that I'll hit on a lot more in a minute, and that is stay at home. Consumers want to be at home. That's the thing they value the most. And then lastly, one thing I would touch on is the blurring of the lines between pharmacy management and medical management. Anybody heard of these new treatments called CAR-T therapies? CAR-T are treatments for certain tumor types and cancers where they extract certain elements out of your body, they manipulate them in the lab, and then they put them back into your body to basically form an immune response to the cancer. And when you think about just the power of that, is that a pharmacy issue or is that a medical issue? It's both. And when you think about the funding of it, the financing of it, the cost of it, the efficacy of it, there's a lot of blurring of lines with this amazing innovation that will truly extend life. It's truly going to present some better cures. It's going to improve quality of life in ways that really have not been ahead of us up until now. And this idea here of seniors and what they want and expect is really important. And you can see that, seniors, this conversation is being managed by their expectation, and what's happening to them. There's a rise of chronic disease. The older you get, the more chronic disease you have. That's common thinking. We're working longer here in America. It's a fact. I mentioned the financial means. There's no question that's challenging the conversation. And when you think about what they're telling us they want whole person care. They want us to know them as a company. They want us to understand the context of their life. They're not saying it in those ways, but their actions are speaking it in volumes. And as we're thinking about how we solve the aging of America, how we solve the problem for that individual customer, they want it to be personalized. And that's a very important thing. It's what we all want. And I think you all could think about your own experiences with the other companies that you deal with as you buy goods. And it's that customer first mentality that I think we all appreciate. We got to bring that to healthcare because it's not been brought to healthcare up until now. And I think more and more companies, we're one of them, are starting to think about what does that look like. I mentioned the aging of America. This slide kind of walks you through what that looks like. And on the far left, you can see there's more people year over year who have chronic disease. You also see that as in the cohorts of those age bands in the middle, that the older you get, the more chronic disease you have. And then finally, you see on the far right, the impact of matching those things together. More people falling into the far right bucket yields more cost into the system. This is not just higher unit cost of whatever it is you're buying or whatever it is you're using in terms of the drug or the procedure or the hospitalization event. This is about more utilization in the system because of the aging of America on the far left. And all that's coming together still today in what is largely a disaggregated episodic healthcare system that is not practicing across the U.S. in a value-based relationship, where physicians and the community is practicing around whole person care, not episodic care. And that's the piece that excites us because there are communities where that is thriving. And there are communities where that is coming alive nicely that I think can help deal with this aging process and this aging of America process that we see in front of us. And that yields to the so what. So what do we do about some of this? And this is a simple slide, but this is a slide demonstrating what you do about it. This is about slowing disease progression. And this is diabetes. And as you look from left to right, these are avoidable events. They require good behavior on the consumer, right? You got to change what you eat, got to change your lifestyle, you got to do the right things, you got to take your medication as prescribed, you got to get a little exercise. There's a lot of things consumers need to do. But at the same time, it also requires the physician community to be engaged. It requires health plans to be engaged. Because that area between that plumb line and the green line is the opportunity. That's the fundamental wastage in the system. There's a few articles that have been published in JAMA about the wastage in the healthcare system. And if you go disease by disease and look at the area between those two curves, that adds up to about 25% wastage, right? You could call that poor quality as well. You could call it the opportunity. But how do we engage to keep those complications from happening? I would submit to you that's probably the one clinical quality metric that matters the most is avoidable events. How do we do things to help consumers avoid these events? It's better quality for them. They can stay at home. Their lifestyle is improved, but it also takes the cost out of the system. You can see as you go left to right in that high severity to low severity, the impact to the system of these types of costs because these events are not avoided. And when I talk about value-based care, that's what I'm talking about, is how do we get the physician community the health plan community, the consumer community, to think about how to avoid these events so that those costs can come out of the system and quality can be improved. And then you have this idea of health meets lifestyle. And what does that look like? And without question, the health of America and the disease process is something we thought about a long time. But it's not been common to think about lifestyle and understanding the context of someone's life. That's the social determinants. You heard that mentioned in the intro. Social determinants matter. I have a situation that has just come in front of me over this past weekend with Uncle Bill. Uncle Bill is my wife's father's brother. And Uncle Bill lives in the Midwest. Uncle Bill is 88 years old. Uncle Bill is a Humana member. Uncle Bill has lived over half his life as a widower. Uncle Bill he doesn't have anyone around him. He lives in his home. Uncle Bill is a farmer. Uncle Bill is a businessman. Uncle Bill's still working today. Uncle Bill had a big event, and he had a hospitalization. Uncle Bill tried to be engaged by some care managers from our company back probably 60 days ago. Uncle Bill stopped returning their calls because he was terrified that they were going to tell him he can't live at home anymore. And the one thing he wanted the most is to live at home. And so Uncle Bill stopped returning phone calls. He got hospitalized this past weekend with a stroke. Now he's doing fine, but it shows you understanding what matters the most and how to articulate that, how to have that conversation with consumers. It really can change the outcome of what they're dealing with and how they can have the right quality of life throughout their life. And so what I like to do is share with you a perspective to bring alive further this idea of social determinants and how health meets lifestyle. As we started this conversation around our interventions and all the care coordination and care management and care delivery that happens in the system, one of the things that we learn about most of our customers is they got to trust us up front. They got to trust that we got their interest at heart because it matters. And as Dawn was engaging with Joe, one of the things that I think Dawn figured out really quickly is that Dawn is showing up to help Joe with Joe's health, but that's not what's important to Joe. Until we solve Joe's disabled son's issues, there's nothing that matters around Joe's health. And so that's what Dawn worked on as the care manager. Something having nothing to do with the health of Joe, but everything to do with what mattered the most to Joe. And once those things started happening, it then allowed Dawn, the care manager, to help Joe deal with her very important health issues. This was videoed probably about 10 months ago, maybe 11 months ago. And the rest of the story is Joe has lost about 20 pounds. Joe has stopped smoking. And Joe has only had one hospitalization event in the past 11 months. And the year before that, there were 5. And so it shows the power of understanding social determinants of health in the context of someone's life. What you see up here on this slide are our beliefs, rightly or wrongly, around the 5 areas of influence that probably matter to most of us in some way, shape, or form. And the 5 areas that need to change, that need to evolve, that need to be connected together. And that is primary care and home care. That is also understanding behavioral health, pharmacy, because it's the first used and most used benefit that we all use, and social determinants. And as we bring the system together, it's that connectedness, it's that integration that we think can produce better health outcomes, deal with the aging process, but also put people where they want to be. Let Joe stay in her home, but also let Uncle Bill stay in his home. And have that conversation in that way so that we can truly deliver improved quality and take that wastage out of the system of the aging process that I showed you in diabetes. And so how does all this happen? How should we think about evolving this? This is complicated, with the disaggregated episodic system that we all live in. People are trying. but there's more that's got to be done. There's technology advancements that have got to be done. There's process advancements that have got to be done. But we also know that we can do this, that we've got to evolve the operating model around healthcare. That this, we need clinical services for all of life stages, and to really understand the jobs to be done. Someone who is just entering the retirement process is probably thinking more about downsizing from big house to little house than they are of multiple chronic conditions. Those things matter, and treating people differently in the context of their life and their means versus no means is very important as we go through this process with our customers. We need a differentiated primary care model. The primary care model of showing up at your doctor and having referrals out, and there's not that coordination back, is a real challenge. Those things have got to be connected between primary care and specialty care better than they are today. Care in the home. I mentioned Uncle Bill, you saw Joe. Those are very important. People want to be in the home. More things can happen in the home. It's the lowest cost side of care. It's where people want to be, and we can meet them there. And we think that's a very important thing to do. And I'll talk about Bowl Goal and trying to get the community involved, the greater community of Louisville and San Antonio, and you can name the city. And finally, the social determinant question. And it's all leading into this, that if you look at the sort of the top half, bottom half, we want to move from episodic touch points to this notion of integration. It's a no regrets move. It's the one thing that companies that do well when they integrate, they'll produce better outcomes, a better customer experience, and truly give people what they want. And as we're going through this idea of care teams and virtual care teams and bringing the power of the technology that we have in front of us with telehealth and remote monitoring, we know that if the system can deliver upon those things, we'll better understand consumers, we'll better understand what's going on, and I think we can deliver better outcomes for the customers around us. And that's all in the spirit of the disease process, from good health to restoration when you have a problem, to palliation when restoration can't happen, to advanced illness and ultimately hospice when that's appropriate. And it's understanding that living process, the health process, but the disease process, that we believe the system's got to continue to learn, bring forward things like machine learning and better analytics to understand what good quality looks like. There's tons of data in the market that will demonstrate to us when people get diagnosed with blank, this is typically their disease curve. And using that not only from the physician lens about what to do, but the patient lens and the caregiver lens and the family lens about what to expect, we think is super important. But it's digging deep in that, not only with the interventions, but the analytics and the technology to bring alive these types of care models that go from good health ultimately to advanced illness. Because it's the living process, and it's something that we should not be afraid to talk about. We should run towards it and have an important, open conversation about what all that looks like. When we think about differentiated primary care, as you look on this slide from left to right, you can see some of the advantages in these bubbles or these boxes about what primary care looks like in the big letters and what episodic primary care looks like in the small letters. And what we believe is by delivering more whole person care, it allows the physician to practice at the top of the license. It allows them to really work on the whole person and not just deal with the consumer from an episodic point of view. And when you do that, we have tremendous examples that good quality comes out of it. But we got to get the system in these communities to start working in this fashion, because when you do, amazing results happen in taking those costs out of the system that I mentioned earlier. And ultimately, more care in the home. You heard me talk about Uncle Bill and Joe. These are really important. Consumers want to be in their home. There are advancements in technology, and you mentioned in the intro there was some mention of upstart companies and innovators and entrepreneurs. These are happening across the U.S. where there are tremendous companies going in the home today delivering primary care, delivering the lower end of the emergent care process. There are companies leveraging technology to help bring these advancements forward. And I would agree that I think the Louisville community is an amazing community when you look at the companies here around aging. And we need some of that entrepreneur spirit to help us think through, how do we keep people in their home? There's more that can be done there. Someday maybe there's some lower end hospitalization stuff that could be done in the home. We know that people are thinking about those things today, and I just invite all the entrepreneurs to help us think through remote monitoring and the role of tele. And as we think about how to advance some of this, it's really important for us to find those folks. From a Humana perspective, we took a big, bold step to go into the home, leaving summer of 17, and the deal closed in summer of 18. I'm sorry, in December of 17. The deal closed in summer of 18 with our acquisition of Kindred at Home. We bought Kindred at Home because we believe we needed to own the payment model that helped transform home health. And as we think about this opportunity, what it's going to give us is 50,000 clinicians, seeing over 100,000 patients every day, helping people do the one thing they want, stay in their home. And it's that transformation. It's bringing alive what home health is today to what it needs to be tomorrow with technology and advancement that we think is part of the solution, because it's what consumers want and it's how they want to show up. And as we think about furthering some of the things that we believe need to be done, it's also mobilizing the communities that we all live in and that we work in. Humana launched a number of years ago, about 7 years ago, our bold goal. And our bold goal is an associate thing that's our battle cry for improving the health in the communities we serve by 20% by 2020 and beyond. And you can ask some of these Humana associates that are here as well about their view of bold goal and how it inspires that battle cry. And what this is about getting local community involvement with the local health leaders, with local business, with local government, holding town halls, having open, candid dialogue about disintegrated, episodic, moving towards value-based, away from volume-based. And it's having those conversations at all those levels that matter. In some communities, we've been doing this a little bit longer, like San Antonio. Some communities are a little newer, like Louisville. It's been going now for 3 to 4 years. And we've seen some amazing results in communities where we've brought this convening function of convening these important businesses, these important community leaders into a conversation in town halls and forums where we can have the dialogue and actually take ground on some solutions. And I'm proud to say that one of the metrics we use is something called Healthy Days. And Healthy Days, it's a Center for Disease Control measure, and it measures how many days in the last 30 days were you physically or mentally unhealthy. And it allows us to understand, are we taking ground in a very regimented sort of way around improving the health. And you can see some of the results that we are seeing ground taken in the communities where we brought alive this convening function of convening these important industry leaders. And along the way, what we've done through some of that work is start to operationalize social determinants. The key word there is operationalize. It's easy to talk about addressing it, but how do you operationalize it? How do you make it easy? How do you make it so that if someone needs food and they're leaving the hospital, they're at home alone, they just had a major event, they don't have the right food at home, how do we make sure that they get that food this afternoon? You've got to operationalize that so it's easy. Right now, it's complicated. There are some upstart companies trying to solve that operationalization problem because there's so many dimensions of social determinants beyond food, isolation and loneliness, and we can keep going on and on. But it's that operationalizing that I think is really important to make it easy for the caregivers, the clinicians, the doctor's office, the hospital, the health plan to be able to bring these things to life when they see that a customer, a consumer, a patient needs this level of service. So you can see how that's coming to life, and we've been doing it there for a number of years. We also have the Louisville Bowl Goal. Louisville's one of our Bowl Goal markets where we're serving as the convener and a convening function trying to bring folks together. I know there's a few people who serve on the Louisville Health Advisory Board in this room today, and I also know that there's a few folks speaking like Grace Simrali and Teresa Reno-Weber later today, and so thank you all for your participation on that. Because when we started this, we're not sure we exactly knew where this was going to go. We're not sure we exactly knew what was going to happen, but we believed that if we got smart people in the room in the communities, good things would happen. And that's, in fact, what we've seen. We've seen conversations come forward. It's not perfect. It's not the answer by itself, but we know that if we can get the local community working together, great things are going to happen for consumers. So that's my story. I like to stop there and say thank you, but also ask you if you have any questions. We have about 10 minutes for Q&A, and so hopefully you've been thinking about some of this, and love to hear your thoughts, your feedback, or your questions over the next few minutes. So thank you very much. All right.
Hopefully folks can hear the question, but
I'll repeat it.
Since you have a lot of experience in pharmacy and there's a lot happening and changing, what do you see different in terms of consumers' experience with pharmacy around specialty pharma, specifically specialty, but it could be other areas in the next 5 years or so?
So the question was the changing perspective of what's happening in pharmacy and what should consumers expect in the next 5 years. I would tell you it's a great question. The rise of specialty drugs. Everybody know what a specialty drug is? High cost, amazing, just some amazing technology, a lot of refrigeration, but at times just simply it's high cost, impacting few people. Less than 2% of the people are now consuming about 40% of the pharmacy dollars these days. And so I would tell you the pipelines are rich. I think the big thing in front of us from a U.S. perspective is the affordability. We got to solve the affordability problem. Right now, since it's 2% of consumers consuming 40% of the dollars, I think there's a big question of how do we make sure that it's affordable so that these tremendous advancements can thrive. We've seen advancements in the last decade in things like multiple myeloma, hepatitis C. You can name a number of other cancers and tumor types. There's some nice advancements in diabetes, and so there's going to be some more of that. My hope, although it's not looking great, candidly, is in Alzheimer's and dementia. We're finally going to see some advancement. I see an amen there, but the challenge is those treatments they're not getting through the clinical trials, and so there's some frustration that's happening there, and that's probably the one area I would tell you all is you think about those 5 areas of influence that I mentioned: primary care, home, pharmacy, social determinants, and behavioral health. It's the behavioral health piece that I think is the most complicated and the most challenging, and the one that if we can figure out how to unlock it, whether it's with medication or not, can yield the best results from a clinical quality and ultimately healthcare cost and usage of the system perspective. But the future's bright. In pharmacy. The future's bright in specialty. I think the question is, the consumer expectations with digital and rise of Amazon and, convergence of CVS and Aetna, and what's going to happen with all that. It's going to be fun to watch this market shape itself and, frankly, reshape itself as the next few years come and go. Other questions? So there's no question. So her question was keeping people at home against the shortage of nurses and what's coming at us, and how do we solve for that from a capacity creation perspective? And I do think that part of the solution is tele and the role of digital. I think part of the solution is other skills like social workers and the like. And part of the solution is just taking some of the, I'll call it the wastage out of the process. You know, how many of y'all been to your doctor lately and they still hand you a clipboard and say, tell me about you? How frustrating is that in today's world? At this point, they should know about you, right? I would argue our clinicians today are more, they're as much today a historian of your care as they are a deliverer of care. And I think the one gift that we could give our clinicians is the gift of time. And get them out of being historians and give them more time to actually deliver care. So I think unlocking some of that, getting some of that administrative stuff out is another opportunity, whether it's at the nursing level, the behavioral level, the doctor level, in solving some of these challenges. It's that translation of data. It's the blue button, as CMS calls it. It's the APIs. It's moving our infrastructures, and we're in the process of doing this ourselves, to the cloud with APIs that allows things to get locked in. It's delivering to healthcare what Amazon arguably has done to consumer goods. You all do realize Amazon does not have databases of shoes in the US, right? They don't keep a database of shoes. What they have is APIs that says if you produce shoes, plug into us. And when I as a consumer go out and say I want black shoes, they pull up all the black shoes, and it's done through all the API and the interfaces that are created between businesses that allow those transactions to happen in that way. They are a convener of shoemakers. They don't have databases of shoes. And I share that example with you because the way consumers interact with healthcare is no different, and it's the interoperability that has got to be solved for along the way to help solve some of those problems, I think.
I have a question about moving in your great slide about moving palliation, chronic care into advanced illness care. With the advent of the MA carve-in, Medicare Advantage carve-in, the hospice benefit will be absorbed by your plan and others. How do you see that changing the landscape of hospice care at all and advanced illness care?
So his question was, there's pending hope, I'll call it, that hospice care will move back into Medicare Advantage. For those of you who don't know, today, when you're in a Medicare Advantage plan and you need to go into hospice care, you leave the Medicare Advantage plan, all the relationships that you have and all the payment, all the things that happen there from your financing and funding of care stop, and you move into hospice, really at a time when you need it the most. And those things were created many years ago, and they've not been solved for, is your point. And so moving it back in so that you move from one part of the disease process of health to restoration, to palliation, ultimately to advanced illness, so that it's synced up. And so, you know, there's potential for that to happen. There's some pilots coming, right? There's CMS demonstration project that's coming in front of us. It's not been fully funded or agreed to yet, but I do think that could be quite transformative when consumers, in a good way. It could be positively transformative, positively disruptive. It could deliver better quality in the sense of that, just that change in the most stressful part of that process. We're optimistic about it. Obviously, we are supporting it with some of the work that we're doing. We believe it's important because we also know that one of the most important people in that whole process is the home health aide. And you know, it's interesting, as you go from home health to hospice, you lose your home health aide, the person that's seen you naked, the person that has dealt with you, through your disease process, and then you got to start anew, right? And so it's all that tension that comes with that. So we're optimistic, we're hopeful, we think good things can come out of that, but we also know that it's probably a few years away, unfortunately, from seeing that into reality. There's a mic right behind you if you want to. Or you can just yell it out either way.
Okay. Is it on? I don't know. Anyway, if you can hear me, my name is Karen Handmaker. I'm a member of the Louisville Health Advisory Board, and I really applaud Humana for the great work you're doing, not just in Louisville, but in all these communities. And one of the reasons that you are doing so well is because you have an aligned incentive with what the right outcomes are for your patient populations. Still, in our country, we have fee-for-service that is dominant. How are you, as Humana, helping to align that, or what else can we do to align the incentives all the way down the line, from the patient consumer all the way up to the health plan through the providers?
Well, see, and what she's getting at is, the payment model. The payment model's got to follow for those things to happen. It's got to lead, actually, for those things to happen. For us, the thing we're doing is we're going to the various communities. We've taken the value-based payment model to communities like Greenville, South Carolina, to Baton Rouge, Louisiana, to New Orleans, to Kansas City, to Chicago, to Louisville here. It takes time, and we're one payer doing that thing. We need others to come with us because we know good things will come out of it when it happens. There needs to be a movement on the payer side. There needs to be a movement on the provider side. Those things have got to meet for it to really come to life in these communities. When we see it working well, it's amazing. I mean, I would tell you, Greenville, South Carolina, if you saw what's happening there, it's amazing because when people see how physicians are practicing over in those clinics, you start wondering, hey, I want to do that. Let me do that. And that what makes them want to change their practice. When the health plans see what's going on there and see the wins in that little community, they want to come in and be part of it too. So it creates a competition of sorts. But there's no question there's got to be a movement. It's got to happen on the payer side. It's got to happen on the provider side. It's early. It's early. But when we see it thriving, amazing results happen. And it's happening in Florida. It's happening in Louisiana, Nevada, Arizona. Back of the room.
Where do you see Humana? What does Humana grab all of this and most of its medical analytics to basically go down this road of educator and commercial care? Number two, where do you see Louisville as an entrepreneurial community being able to be a up-and-coming or major player in that medical analytics community?
So the question was around analytics. Where do we get our analytics, and the role of Louisville in helping thrive around analytics. A lot of our analytics come internally. Right now around arguably a lot of claims data, demographic, psychographic data, other data we can buy. We're starting to bring a life social determinant data. You can imagine the power of just knowing someone is lonely or isolated. Would we make a different decision about them leaving the hospital if we knew they were going to a home where their bedroom was upstairs, they have no one to help them, they don't have edible food? We might make a different decision about that outcome. And it's the power of the analytics that help us think through that. I would tell you, we just brought online last Thursday, I think it's the first APIs, translation of data between two separate companies in the US, between us and an in-home wellness vendor. We have this program called Intelligent RX. Intelligent RX is a bunch of analytics that looks at your risk of adverse drug events and drug-drug interactions, drug disease conflicts, and the like. And we send that out to our internal nurses and caregivers and physicians and the like. But we've been wanting to get that outside of our company into the community. So we worked with this other company to develop the API, so when they go in the home to do in-home wellness assessments, they got the information too. And it's a two-way communication. So that just went online last Thursday. In the first 4 days, we saw some amazing results. One of the amazing results we saw is 70% of the consumers that were interacted with, the clinician, that nurse in the home, told us about medications that the patient was taking that we did not know. Because they were nutraceuticals, they were over the counter, they were something that the consumer bought themselves outside of their health plan benefit. And it's the power of getting that data back into our system that we believe could produce even better analytics. So I would tell you, we continue to look for data. We have tons of claims data, we have tons of psychographic data. We're now getting patient-reported data and clinician-reported data through that type of example. You might have seen that we just launched an initiative with Epic, one of the main physician operating platforms here in the US, that will now give us more electronic medical record data to put into the Scrum. That helps the physician from a productivity and administrative perspective, but it gives us the analytics about what consumers need. So a lot of work on data. Second thing is, what can people do to help? We need more analytic thinking. I mean, we are doing some work with some third-party entrepreneurs. Javion is one example of that, where we're trying to use their mindset in our world. One of the things I've learned in my career is I can show you people who should be interacted with and who are not following certain care plans. But what I can't show you definitively are the impactable members out of that set. Those people who are willing to change, the physician who's willing to change, the patient who's willing to change. And it's that impactability metric that I continue to struggle with. How do we solve not only who needs the interaction, but who's impactable? That's where behavioral economics and other, I think, theories come into play. I think I have time for one more question. I'm getting the, all right, you and the, right.
Can I get the last one then?
Yep.
So, all this exciting conversation about the integration of care and lowering costs and keeping people in the home, and despite all of this and all the incredible work Humana is doing and here in Louisville, there's one glaring issue that I haven't heard throughout this entire conversation, and that's the most expensive disease in America, which is Alzheimer's and related dementia. And currently there are 5.8 million Americans living with this disease. To compound that issue, most of the individuals who have Alzheimer's and dementia, including about 90.4% here in Kentucky, are also dealing with another chronic condition. So where does that disease and how much money it's costing this country, we're talking billions and billions of dollars, where does that fit in amongst this conversation?
It's important to the conversation. I appreciate you bringing it up. For us, it falls in the behavioral health piece, but it's also the most challenging piece because there's not been tremendous advancements in the pharmaceutical side of it. It's a complex disease to get drugs across the blood-brain barrier and actually have them reduce the plaques associated with Alzheimer's. It's very, very challenging. We lament when we see a drug manufacturer withdraw a drug from clinical trial because it failed. Because it's the one disease I personally would never want. Give me anything, just don't give me dementia, right? But I would tell you on the positive side, we're in the process of launching a pilot with a third-party company that is around dementia. And it's the question we're trying to solve is, should we go at the patient with dementia or Alzheimer's, however you want to frame it, and deal with the patient from a caregiving and all that perspective, or should we support the caregiver who's helping the patient with dementia? And so what we're trying to test is, I think our test is ultimately going to be patients with dementia who have caregivers, can we support the caregiver and that be the positive outcome? Because a lot of that is people like us coming to meetings, working all day, going home, and mom or dad is sundowning at night because that's part of the process. You don't know what to do. They're agitated. Your only choice is to take them to the ER because you don't know what else to do. So the question is, can we support the caregiver? It's an example of a test. We don't have the answer. Candidly, I wish we did. Otherwise, we wouldn't be talking about it. But we don't have the answer. I'd say it's the toughest thing we have to deal with. I've got solutions for CHF and diabetes and asthma and COPD and cancer, and you can name multi-chronic, polychronic, this and that. Dementia is the one biggest challenge that I would say that we're faced with. That's our one solution that we're working on. All right, I think I'm getting the hook here. Thank you all. Thanks for the opportunity, and hope you have a great day.